Let's begin with the latest COVID data, and here's the most important number in the last 24 hours. That's our vaccinations, and that's down to only 11,66,000. That means our vaccinations daily are down by 11%. This is actually the lowest since mid-March. Our cases in the last 24 hours are 2,76,110, up slightly 3%. Deaths in the last 24 hours are down, but again, there's a big query about the official recording of COVID deaths. Our tests in the last 24 hours are over 20 lakhs at the highest testing for the second day in a row, up by 2.27%. Our positivity rate is 13.43%, the same as yesterday. So let's just look closely at the vaccination data. Our vaccination doses, as we can see with this graph, have now fallen to our lowest since March the 15th. So those are worrying numbers, because of course as cases are coming down, we want to bring vaccination up to prevent a third wave. And look at what our world data says, a comparison of, for instance, just what India and China's vaccination rates are. Now, according to our world, China is vaccinating 13 million people a day. In contrast, India is doing just 1.3 million a day. So we really need to close that gap if we need to make sure there's no third wave. Meanwhile, according to government details today, 8 states now have active cases below 1 lakh. That's down from 13 last week. And 35 states have a positivity rate of more than 5%. That's 3 more than last week.
We request that rapid antigen tests be done, because there you can get the result immediately. When the positivity rate is high in the city, in the district, in the country, in the village, then you can rapidly isolate those who are positive. So that is why we are now doing 20 lakh tests. Our target is to do 25 lakh tests by the end of this month and 45 lakh tests by the end of June, and I will talk about that a little bit.
So antigen tests now the focus, and meanwhile the centre has now told states to notify the disease black fungus under the Epidemic Act, which means that this will have to be notified to all state governments and centres. The centre has also said the black fungus is now a new challenge, and treatment needs to a multidisciplinary approach and to be standardized. Many states across the country have already declared this an epidemic.
63-year-old Kishore Punjabi recovered from COVID but was attacked by a fungal infection, Mucormycosis, that forced doctors at a private hospital in Mumbai to surgically remove his right eye and underlying dead tissue.
ऑपरेशन अराउंड 12-1 बजे चालू हुआ रहेगा, करीबन 4 बजे तक ऑपरेशन खत्म हुआ, तो उसमें उनका एक आंख निकाला और साइनस का पूरा पार्ट जो सड़ा हुआ था स्कल बेस तक जाके वो निकाल के क्लियर किया.
With hundreds of such cases of mucormycosis or black fungal disease that affects the eyes, nose, jaws and could even spread to the brain being reported across the country, the centre has asked states to notify it under the Epidemic Diseases Act. Notifying mucormycosis under the Epidemic Diseases Act will mean that every government hospital, private facility or medical college will have to notify the health authorities on all suspected and confirmed cases. That will give clarity on the total number of such cases, and the government will be able to better plan allocation of the antifungal drugs which are right now in very short supply. The ICMR health authorities will also give guidelines on how to screen, diagnose and manage the disease. The centre has said black fungus has become a new challenge reported among COVID patients on steroid therapy and deranged sugar control, and is leading to prolonged morbidity and mortality. Already Maharashtra has reported 1500 cases and 90 deaths.
म्युकरमायकॉसिस म्हणजेच काळी बुरशी या खऱ्या अर्थाने फंगल डिझीज मुळे राज्यामध्ये एकूण अंदाजे 1500 पेशंट्स प्रोग्रेसिव्ह म्हणजे आतापर्यंत आपल्याला पाहायला मिळतात.
Gujarat is suspected to have 600 cases, 420 in Madhya Pradesh, while Telangana has nearly 300 cases. Karnataka and Rajasthan have both reported 100 cases each. In Delhi, there are an estimated 250 cases, and a private hospital has reported 1 death.
So far, we have treated 5 cases of black fungus, and out of those 5 cases, 2 patients were very severely affected, and one of them, although both were operated, one of them lost the life because it was at unsalvageable stage and we could not save the patient.
Assam reported its first case of a 27-year-old patient who recovered from COVID without going to the ICU but was severely diabetic and succumbed to the fungal disease on Wednesday. With huge shortage reported in antifungal drugs like liposomal amphotericin, Telangana, for instance, has constituted a government panel to regulate supply and stop black marketing. With inputs from Pooja Bharadwaj in Mumbai, Parimal in Delhi, Ratnadeep in Guwahati, Uma Sudhir in Hyderabad for NDTV.
Meanwhile, a government panel has now come out with new guidelines on distance that you should keep and other important measures. Sonal has the latest. Sonal.
Right, Sonia, we have all heard in the iconic voice of Amitabh Bachchan, "Do gaz ki duri, mask hai zaruri." And this line now might need a revision, because now "do gaz" is not enough, because now aerosols are said to travel even longer. What are aerosols? Well, these are very tiny droplets which could be COVID infected. So in this scenario, ventilation really becomes the key. In your homes, in your offices, you now need to keep your doors and window open. And yes, it's the summer and everybody's air conditioning is on, but despite that, the advisory says that your doors should be open. In buses and trains, they are now going to introduce high intensity exhausts, again to ensure that ventilation takes place, and air conditionings now to have the HEPA filter, extremely key to try and fight out. In addition, obviously, this is all in addition to the earlier mentioned COVID appropriate behaviors like double masking, washing hands, testing and more testing. And talking about which, a good news on that front as well, as now the government says you can now DIY your testing at home. This has been introduced by the government to do-it-yourself COVID kit just at ₹250, and it's aptly called the COVID Self. Now it's ICMR approved and you do not need a prescription for it. Soon it is going to be available in the pharmacy near you and also online. So all you need to do is take a sample of your nose swab yourself and do the test at home. Though there are still questions on reliability of this test. Remember, this is an antigen test at the end of the day and might miss some positives, especially those of asymptomatic infections.
Thanks so much, Sonal, for that update. But meanwhile, moving to another special report by NDTV, we're looking really at why deaths in the second wave have been so high, even as cases are coming down. Now, of course, there is a 14-day lag as well. But what doctors have told NDTV is that in the second wave, they're seeing the survival rate from ICU patients is much, much lower.
While COVID cases have started seeing a decline, in India's worst affected cities, deaths are still high, with many in the ICUs not surviving. In Delhi, cases have come down by 75% in the last 10 days, but deaths have reduced by only 27%. At Delhi's biggest private hospital chain, Max Hospitals, more than 30,000 patients have been admitted in the second wave since the first week of April.
And the most striking difference is an increased mortality rate this year. So this mortality rate last year was around 6%. This year that cumulative monthly mortality rate has increased to almost 7.5 or 7.6%.
Officials of Delhi's biggest government-run COVID hospital say late hospitalization has played a role.
हमने अभी तक अप्रैल से लेकर अभी तक हमारी क्यूमुलेटिव एडमिशंस है अप्रैल से अभी तक 6,500 के अराउंड हैं, जिनमें से 20 to 25% लोगों की डेथ हो चुकी है। ये शायद इसलिए इस बार हो रहा है क्योंकि इस बार दो चीज़ें एक साथ हो गई। एक तो लोगों को एडमिशंस के लिए थोड़ा स्ट्रगल करना पड़ा, लोगों को बेड की अवेलेबिलिटी नहीं हो पा रही थी, एंड सेकेंडली ऑक्सीजन का क्राइसिस भी साथ साथ ही हो गया, जिसकी वजह से लोगों में काफी पैनिक हो गया।
In Mumbai, cases have come down 25% in the last 10 days, but deaths have reduced by 23%.
Second wave, there is a substantial amount of patients which we are seeing are taking longer to recover as compared to the first wave. And this is not particularly seen in patients with comorbidity.
Our mortality rates in the ICU are about 10 to 12%. Not only are the younger people getting affected, but like last time, there's a vast difference in that the virulence of the organism seems to be more.
In order to handle critical care patients, both central as well as state governments are ramping up the number of ICU beds as well as the production of oxygen. But it could take the next few days or even weeks to see a clear impact of these measures. With Pooja Bhardwaj in Mumbai and in New Delhi with camera person Sushil Rathi, this is Sukirti Dwivedi for NDTV.
But also what we are seeing is incredible stories of survivors, people who fought back against all odds. Joining me this evening from Manchester in the United Kingdom is Dr. Anusha Gupta, who's a family physician and also a COVID survivor even after spending 2 months in a medical coma on the ECMO machine. Thank you so much, Dr. Gupta, for joining us, and it's really wonderful to read about your story and what you said. Coming back after being 2 months in a medical coma, what was it like? Apparently, you had actually said your final goodbyes to your family, including your young daughter.
Yes, well, thank you and good evening to you. Yes, this was about 2 weeks after my 40th birthday last year, so March 2020. I became very unwell and, suddenly I deteriorated, and the ICU consultant came to see me up on the ward and said that I would have to be ventilated. And at that time, my oxygen saturations were extremely low, about 80%. And, I called my husband on the WhatsApp and said, look, I need to see our daughter. I was really worried that I wasn't going to make it. And that was it really. I had to be ventilated and I was in a medical coma for 2 months. So within that time, I actually deteriorated further. So once I was ventilated, 10 days after, I had to go on ECMO. So ECMO is extracorporeal membrane oxygenation. Mm-hmm. And it's the most superior form of life support. And I was on this for 34 days. So yes, that took me up to around 2 months of being in the coma. So
it's really, you're a miracle story really, Dr. Gupta. It's really lovely to have you on the show tonight. But just for all our viewers who are watching this program, suddenly we've seen in the Indian medical vocabulary also more and more people are going online saying we need an ECMO machine, we need an ECMO help to get an ECMO machine to this hospital. Firstly, of course, it's hard. How does a patient arrange an ECMO machine? But can it save you? Because many people think that when you're asked to go on an ECMO machine, it's virtually saying that it's all over. You're living proof that's not true.
Well, it's the last resort, basically, and there are many criteria that one needs to fit before you're considered to go on ECMO. So ECMO is like having a pair of lungs that is basically doing the job of your lungs whilst your own lungs, rest and repair itself. So there's many criteria, one of them, is this person sick enough to go on it, and are they going to survive? Are they going to have a good outcome from it? And in the UK, they only have 5 centres, and I was lucky enough to be at Wythenshawe Hospital in Manchester, which is an ECMO centre. And yes, it obviously did save my life. Yeah.
And of course, Doctor, in India, the second wave, which we're still battling through, which is the B1617. I know in the UK also some cases have been reported now of this B16712. The report we just saw, that this time around it's much more virulent, and the survival rate in ICUs is much lower than what we perhaps may have seen once doctors had got the first wave under control in India. As a general physician, as someone who's observing what's been happening in India as well, what are your thoughts on this? What would you tell patients right now or their families who are struggling through this?
It's really difficult. I mean, in India, the population is so huge compared to the UK. But certainly one thing that's worked over here that's brought the rates down is, one, having strict lockdowns, abiding by social distancing rules, and of course, vaccination, which I heard one of your physicians talking about. I think the vaccination rate needs to increase, certainly, and it will really help. But I think the basic things is abiding by social distancing rules, definitely.
And what kept you going, Doctor? What was the one thing you think which kept you going through all this?
I'd have to say my family, my daughter, my husband, my family have been absolutely amazing. They've been behind me every step. And this is why, I've got to say I've had such a good outcome. And of course, thanks to all the teams that looked after me at my hospital in Manchester, I was very lucky, very, very lucky indeed.
Dr. Gupta, it's been wonderful to have you on the show and to talk to you. And as I said, I think stories like yours gives hope to so many other people and families and loved ones who are battling through a similar situation. Thank you very much.
Thank you so much.
Well, moving now to other news, and in politics, Kerala's new government has taken charge with Chief Minister Pinarayi Vijayan at the helm, the second time running, which is a record for Kerala. But The rest were all new faces, in fact, with 17 first-time ministers. Sitaram Yechury also said that the cabinet was chosen collectively. It was a collective decision, referring to the controversy over the dropping of popular health minister K.K. Shelja.
Pinarayi Vijayan sworn in as Chief Minister of Kerala. First ever in the state for a consecutive second term after a full 5-year term. That, and being the only left government in the country, seems to have increased his clout in the party. The controversial move to drop K.K. Shelja as health minister and the unprecedented move to drop all the outgoing ministers from the CPIM and to include DYFI national president and his son-in-law, Mohammad Riaz, has been endorsed by the top leadership as a collective decision.
The leader is of course the leader, every individual has a role. But nobody leads the party except the collective of the party. Every decision taken, including the question of this cabinet formation, was a decision of the party state committee, and this instance it was a unanimous decision.
In a rare move, CPIM had named Pinarayi Vijayan the Chief Minister candidate even before voting. Contrasting the years of experience and iron grip of Chief Minister is his cabinet. With 17 of 21 members first-time ministers, 10 first-time MLAs and 3 women ministers, highest ever in any Kerala government. The focus on generational shift and inclusion. Even as 45-year-old Mohammad Riaz greeted the gathering with the trademark left clenched fist, 45-year-old Veena George, a former journalist, 2-time MLA, is set to become the health minister. And K. Radhakrishnan, the left government's first Dalit Devasam minister in charge for government temples. It's a new government, but even the immediate challenge before it amid a pandemic is formidable. While Chief Minister Pinarayi Vijayan has emerged as the clear leader, the party, according to sources, is also gearing up for what could be annual performance audits for the new ministers. With camera person SP Babu, Sneha Koshi for NDTV.
Well, moving from Kerala to Uttar Pradesh, where there seems to have been a dramatic drop in cases and deaths. But however, let's just look at what has also been the state-wise death rates. And this is of course a worry because 2-week deaths have more than doubled in 12 states, mainly in the northeast. Now, the absolute numbers are low, but the percentage rise is high. So you can see in Arunachal, Tripura, Meghalaya, Nagaland, Manipur, doubling of deaths in the last 2 weeks, including Andaman and Nicobar Islands and Assam, which are the other states, are plateauing in a sense, though Tamil Nadu still is seeing high deaths, as is Puducherry and Karnataka. But of course, as I said, UP is the big story where there's been a huge drop in cases and deaths. But when we did this reality check from Noida and Uttar Pradesh, we found the official figures completely contradicted what the cremation figures are actually showing.
This is Noida's only official COVID dedicated crematorium. For the past few days, there have been about 20 funerals a day, a figure which is in sharp contrast to the official death count in this district. According to official data, on the 19th of May, only 5 COVID deaths in the entire district. But when NDTV checked the records of the crematorium, we found that 20 cremations were listed.
Right now I am sitting in the crematorium of Sector 94 Noida, and this is the register where they maintain data of cremations. And yesterday it was 19/5/2021. And according to the official data of UP government, and only 5 were cremated, but according to this register, there are 20 cremations are mentioned here.
It was a similar pattern on other days. 7 COVID deaths reported on Monday by 19 crematoriums, 5 on Tuesday, but 22 actual cremations. In all, official data shows 17 deaths, but actual cremations were 61, over 3 times higher. The medical officer in charge of the district told NDTV that it may seem like a mismatch, but people come from nearby districts. If some die, then they are also cremated here. However, the crematorium documents list the hospitals where the COVID victims have been brought from.
This data is from the only COVID crematorium center of Noida, which is in Sector 94. We don't know, there are several people who are taking their loved ones who died due to COVID to their villages, where they are cremating themselves in their crematorium places, which is just outside the villages of Gautam Buddha Nagar. And there are a lot of people who are taking bodies to their native towns in other cities of Uttar Pradesh and in Bihar. But one thing is very clear, that the data we are getting every day from UP government is totally false. Reality on ground is totally different. In Noida, with Ashok Mahale, Saurabh Shukla for NDTV.
Meanwhile, moving to Delhi, where cases were down today and deaths were down as well, and the positivity rate is now near 5%. So, will Delhi reopen? Here's what the Chief Minister said.
जो है वो कम हो रहे हैं दिल्ली के अंदर, तो रिलैक्सेशन को लेकर कोई बात सरकार वीकेंड पे मैं एलजी साहब से बात करूंगा, एलजी साहब के साथ जो भी चर्चा होगी और जो भी निर्णय होगा हम आपको बताएंगे.
Well, let's look at some other COVID news from across the country, and this typically, Indian punishment for breaking rules, where guests attending a wedding in Madhya Pradesh's Bhim district had to do, this frog jump with policemen wielding lathis to make sure they carried it out to remind them not to break COVID protocol. And also from Madhya Pradesh, embarrassment for Minister Vijay Shah as he had to push an ambulance which he just inaugurated in his constituency. He was going to unveil this ambulance service, but then found that the ambulance wouldn't start because apparently he was sent an old ambulance instead of a new one. So the poor minister ended up pushing it to get it off to some kind of start in his constituency. At least he had a good intention.